Hi, I'm Dr. Lennox Hoyte, fellowship-trained urogynecologist and female pelvic reconstructive surgeon. And one of the few non-gynecologic obstetric-based procedures that we do in our practice is the placement of the abdominal cerclage for women with recurrent pregnancy loss due to painless cervical dilatation. And I get the question a lot from our patients and people in the audience, women in the audience, what is recurrent miscarriage? Well, a miscarriage is defined as the loss of a viable pregnancy before a certain period in the pregnancy, usually in the first trimester, pregnancy up to 12 weeks, sometimes beyond. The otherwise healthy pregnancy will either stop growing, or the fetal heart rate will be lost, or the cervix will just go ahead and dilate before the baby is viable. So when that cervix is dilating, that usually means the pregnancy at some point will be expelled. With usually painless cervical dilatation is what it calls. You go into labor, the cervix dilate, the baby is expelled, and long before it's viable, usually before the 22 to 24 week time frame. So if that happens more than once or twice, your obstetrician or your OBGYN will try and look for genetic causes, infectious disease causes, anatomic causes, abnormalities in the uterine shape, for example, or double cervix and so forth, to explain it. If they cannot find a suitable explanation, and this has happened more than a couple of times, they'll give you a diagnosis of recurrent pregnancy loss due to painless cervical dilatation. And in that case, once you have that diagnosis, you're then a candidate for an abdominally placed cerclage. Usually these are done robotically. Here at the Pelvic Floor Institute, we place a novel robotic cerclage around the cervix to keep the cervix closed, to allow the cervical mucus to protect the pregnancy from inflammatory agents in a woman's vagina and usually preserve the pregnancy. It's very successful. So that procedure is something that we do offer at the Pelvic Floor Institute here in Tampa Bay. If you're interested and you have such a diagnosis, you're welcome to give us a call. We'd love to hear from you, and we'd love to evaluate you and offer you our treatment, which is usually very successful. Please remember to like and subscribe. Leave your comments in the comment box below. We'll try to answer as many of them as we can. It's Dr. Lennox Hoyte, MD, fellowship-trained urogynecologist, pelvic reconstructive surgeon. Thank you so much for watching, and we look forward to talking to you and with you again soon. Bye.
Well, specifically recurrent pregnancy loss due to painless premature cervical dilatation is a condition that affects many women and can be pretty distressing and can lead to loss of pregnancies and premature delivery before the times that the baby is able to survive outside of the womb.